Hi, everyone. We'll get started in just 1 second. If you could enter your name and your organization into the chat while we wait, that would be great, and we'll be getting started shortly. So welcome everyone to our last early intervention series for our ECHO with the pyramid model. Let me go through a few announcements and then we will go ahead and get started. So we are recording this session. If you do not wish to be recorded, please disconnect. This is a community of practice. We really encourage everyone to ask questions and comment throughout the presentation, and then during our breakout groups in the last half hour to really participate. We love hearing all of your insights. We will start with a didactic speaker. Today it will be Erin Barton, and then we will go into our real situations, real solutions presentation and discussion, where we will have Kate share a problem that's been going on with one of the families she works with. And then we will discuss solutions for that in breakout groups. And then we will come back together for like the last 5 or 10 minutes and share what we talked about in our breakout groups. We ask that you protect all individual privacy. Please avoid sharing any real names and de-identify any names and situations. If you'd like, we would love for you to rename your Zoom profile to include your organization just so we can continue getting to know each other better. And if you have any comments throughout, you are welcome to raise your hand or just go off mute, or you can put your questions in the chat and we will make sure those get read. You will get a certificate of attendance for attending the session today. We just ask that you fill out the feedback survey. The feedback survey is very important. We want to make sure that we keep bringing good content and making sure everything's running smoothly. And so it's a really short survey. If you could just fill that out, we will make sure to get you your certificate of attendance for today's session. We have a Canvas page and a website where you can access all of the resources. Both of these have all of our past sessions that we've had. We record all of these and put them on YouTube. So if you ever want to go back and rewatch a session, you're welcome to. And we have resources and handouts from each session as well. So if you have any trouble going onto Canvas, feel free to reach out to Faustine. For our real situations, real solutions presentations, if you are a program or a provider who is struggling with a certain case or a certain class or anything like that, and you want to present to get feedback from the ECHO session, please reach out and we would love to have you present or even just make a PowerPoint and we can present for you. But if you're having any challenges with your program that you would like a little breakout group brainstorming session on, please let us know. Our next session will be November 25th. And so today is the last session of the early intervention series. The next 5 months will be all about transitioning, and it'll be like transitioning from, for example, transitioning from childcare to preschool or transitioning from early intervention to childcare. And our next session is going to be on transitioning within childcare. So if you're in the infant and toddlers group, moving up to an older group and things like that. And we'll have more information out with the registration link, but there will be a lot of useful information around a wide range of topics, not just early intervention. So we really hope you'll join us and keep your eye out for that. Today's session presenter is Erin Barton. She is a wonderful professional in the realm of early intervention and the pyramid model. And today her topic will be on supporting families with children with challenging behavior. So with that, I will turn the time over to Erin.
Thank you, Hannah. And I'm going to share my screen. There we go. Okay. So today is the last of our session together. And as with all previous sessions, I will be checking the chat and I will be, monitoring everything. And I really do welcome any of your comments, questions throughout this presentation. So feel free to even unmute yourself and ask a comment, ask a question during. Or if you feel more comfortable using the chat, you're welcome to do that as well. But I really encourage your questions and comments throughout. Again, I've shared this slide in every session, and it's just a good review to talk about the pyramid model and a reminder that the pyramid model is prevention focused. And so at every tier, we are talking about supporting children's social emotional competence and preventing challenging behaviors. Today, even though we're focused on challenging behaviors in today's session, what we're talking about today really is going to be a lot from every tier. So not just I'm actually not talking just about intensive intervention or the top of the tier today. It's really recognizing that all children engage in challenging behaviors, and that there are things, practices, strategies we can do, and that we can support families in doing to prevent challenging behaviors from becoming severe and persistent. I also want to say that as the last two sessions, we talked a lot about family coaching. And so what I'm talking about today are some practices that are designed to support children's learning social emotional competence, but also to prevent challenging behaviors. And the way that these are framed are specific practices. And so what I want you to think about is how you would coach families in using these practices, using all the strategies we talked about over the previous two sessions. And I will talk more about that as we dive into the session. These are the objectives for today. And again, this is all within the framework of thinking about how we can coach families in using these practices. I want to start with just a quick reflection. So I want you to think about, as we're kind of diving into it, what are your challenges when trying to support families with challenging behavior? And what do you want to help families do? So just spend a minute thinking about this, maybe put it in the chat if you want, or unmute yourself and let me know. I'd love to hear from you if you want to share. Oops. Cultural beliefs, yeah. Understanding the meaning and communication of challenging behavior, absolutely, yeah. We'll talk about that. Yeah, and Sam, that's a great point. Different families, parenting is different across families, across cultures, different expectations for children occur across families and cultures. So yeah, different behaviors might be viewed as challenging too across families and cultures. Anything else? Oops, I went too far. My goodness. Sorry. There we go. Taking behaviors personally, yep, or seeing them as manipulative, yep. Helping to, yeah, support the family, strategies to support the family, yeah. We're going to talk all about that. Okay, so again, just a reminder, what I'm really talking about here is not just the top of the pyramid. This is really about what are the practices we can use ongoing to support families in preventing challenging behaviors from becoming severe and persistent. Oh, here's another one. I want to help families find tools and processes that work for them. Yeah, to have an effective and happy home together. I love that. Yes, we'll talk all about that. Okay, so to dive right into it, what is behavior? Behaviors are anything that can be observed and defined. And so when we talk about behaviors that are challenging, we're really talking about behaviors that adults identify as challenging, right? These are behaviors that impact the child's ability to interact with the people in their environment or engage in the environment in meaningful ways. The way we define challenging behaviors in the pyramid model are any repeated pattern of behavior that interferes with learning or engagement in pro-social interactions with their other children and other adults. Some challenging behaviors are developmentally appropriate, and we're going to talk more about that. So that's all to say that infants engage in challenging behaviors as a way to communicate, and we expect them to. And that as children get older, we expect them to engage in more behaviors that are less challenging over time. As children get older, challenging behaviors might look like prolonged tantrums, aggression, sometimes withdrawal, self-injurious behavior also. And those are the behaviors that we will want to identify and want to prevent from becoming severe and persistent. But we do see some of that in all children. So I just want to go back to this for a second. So we will see all children engage in tantrums, and toddlers engage in aggression sometimes, even 3 and 4-year-olds do sometimes. And so it's up to us to identify what these behaviors are and then create environments in which the behaviors are less likely to occur, and in environments in which children are learning more appropriate behaviors, or behaviors that allow them to access the environment in more appropriate ways and to engage with other friends, other peers, other children, and adults. So these are some core beliefs that we have within the pyramid model and that we've learned over the last decade, several decades, in working with families and with other professionals regarding challenging behaviors. The first one we know is that truly all behaviors are communicative. Behaviors are all communicating something, always. And the same is true for challenging behaviors. Challenging behaviors are simply a way for the child to communicate something about how they're feeling or what they need, something about what's happening for them in the current context. Challenging behaviors are maintained by consequences, meaning challenging behaviors keep happening. Children keep using challenging behaviors because they're working. They're working for that child. And challenging behaviors occur within a context. And sometimes with some children, we see them have challenging behaviors only in one specific context. Sometimes we see children have challenging behaviors in many contexts, right? But a lot of times, challenging behaviors only occur in one setting or one context. And one thing we know is that we can teach children different ways of communicating. And I love thinking about it like that, because it's recognizing that challenging behaviors are also communicative. And what we as adults can do is arrange the environment and change what we do so that we teach children different ways of communicating. And in the context of EI, we change what we do so that we can support families in changing what they do so that they can support their children. And so it's up to us to help families understand all of these core beliefs about challenging behavior. And so we are supporting families in understanding that their child's challenging behavior is communicating something, that the challenging behavior keeps happening because it's working, and that challenging behaviors occur within the context, meaning they don't occur in a bubble. It's really important for us to look at what's happening in that context, because that tells us what the challenging behavior is communicating and why it's working. Challenging behaviors are communicating many different things, but these are some examples. I think what we've learned over the years too is that challenging behaviors are often communicating something about a connection in the environment, either that the child wants a connection with a friend, another peer, another child, with an adult, with their caregiver, their primary caregiver, or they want something else in the environment. They want help. This task is confusing. They don't understand what the expectations are, or they want a specific item in the environment. So I want something, or they're communicating a feeling. I'm sad, I'm frustrated, I'm angry. And we want to then teach them more appropriate ways of communicating those feelings and encouraging them to communicate those feelings in ways that work for them. And that is one area where this is going to be different across families, right? Families have different ways of communicating different emotions and different ways of communicating and expressing emotions. Challenging behavior is often communicating, I need help. And sometimes it's help to understand the expectation. Sometimes it's help regarding wanting more of an adult connection. Sometimes it's help regarding a task or a directive. Challenging behaviors oftentimes with young children are communicating, I don't want to do that. Either that's too difficult, I don't understand, or I just don't like it. And so it's up to us to support children and families in understanding that children can communicate, I don't like it. And sometimes that means, or I don't want to. And sometimes that means that they don't have to, but sometimes they still have to do some things, whether it's for a routine or safety or, something we need them to learn. So we support families in understanding that, yes, children can communicate, I don't want to. And sometimes that means they don't have to, but sometimes they still have to do it. And that's important for us to communicate within that family context. Sometimes they're communicating feelings like I'm afraid, or I don't know how else to communicate this. So it's up to us to support families in identifying what the challenge behavior is communicating. And we're going to talk more about that, and how to support the child in using more appropriate skills to communicate that same message. But at the beginning, when we're supporting families, it's really important for us to help families understand that challenging behaviors are communication. They're not manipulation. They're not the child trying to control. They are communicating. They're communicative around many different things. And so we talk, and this is something, you don't have to use these exact words with families, but we want families to understand this idea of communicative intent, meaning the challenging behavior is communicating, I want you to pay attention to me, or I want more connection to you. And so they might hit their friend right in front of you. They might destroy something right in front of you. And that might be communicating, I want you to pay attention to me, but they don't have the words to say, or the skills. Sometimes they have the words, but they don't have the skills to say, I want you to pay attention to me. So instead of saying, I want you to pay attention to me, they're hitting their friend. And instead of saying, I want more connection with you, I want you to play with me, or I want to play near you, they're taking their friend's toys or their siblings' toys. Instead of telling you, I don't know how to clean up, because they don't know how to express that, or they don't have the skills. Or sometimes it's just easier to throw a big tantrum and to have the parent clean up, right? And so they throw a big tantrum and then they get out of having to clean up. And so it's up to us to help families understand what the child's communicative intent is and how we can teach them either the skills or that they actually do have to clean up. They can't just throw a big tantrum and get out of it. And the same, these are other examples too. So instead of, I want that toy, they might be taking the child's toy from their sibling. Instead of saying, I don't want to stop what I'm doing, they ignore you, right? Or they just keep doing it. Or maybe they have a big tantrum. Or instead of saying, I don't want to play with my friends right now, I just want to play by myself, they get real quiet and real shy and hide in the back of the room, or they have a tantrum, or they throw toys. And so all of these are examples of things of communicative intent that, if you really think about it, are really complex things to communicate, right? Children, I'm sure I've said this a million times already across these 5 sessions, but it's important for us to help families remember that their children, their toddlers just got here. They're just learning how to communicate. They're just learning these social nuances. Language is incredibly complex. And sometimes children are learning multiple languages. And it's really important for us to help families understand that challenging behaviors tell us where the child's at and what skills the child needs to learn. And that for toddlers, especially, and even 3 and 4-year-olds, but in EI, I know we're working with infants and toddlers. Toddlers especially are going to engage in lots of challenging behavior because they're right at that cusp when they're learning language. They're learning that I use words rather than challenging behaviors to communicate what I want. And it's complex because when they were babies, we wanted them to cry to tell us what they wanted, right? Babies cry to indicate a need. And as they become toddlers, we want them to use more different language to communicate those needs. And then the other thing to remember is that sometimes the children have these skills, but the challenge behavior has worked so often that they keep using challenge behavior to communicate these needs because it has worked. It's efficient, it's fast, and it gets them what they want. So it's up to us to support families in remembering that if the behavior has worked for the child, the child's going to keep using it until we shift that dynamic, until we shift what's happening in the environment. So the challenging behavior is still communicating, but it's not what's working to communicate. And we're teaching the child how to communicate using language. And then the other thing that is important for us to remember and to help families remember is that behavior is all communicating, behavior is communicating it. We're seeing what the behavior is, and it's telling us what skill needs to be developed. But the other thing that's important to remember is that oftentimes it tells us that there might be a need in the environment that isn't met for the child. And so that is when it's important for us to really look at the environment, the context, and say, what's happening in this context? It could be a skill, and maybe it's just a skill that we need to teach. But sometimes it's something in the context. Maybe, for instance, there's too much happening. Maybe the child doesn't understand what the expectations are. Maybe the child's not feeling well. Maybe the child, a lot of times with toddlers, right? We used to say, and some people still say this, and sometimes we still say this, that challenging behaviors are attention maintained. They're either attention maintained or escape maintained. And attention maintained kind of tells the reason why I don't like saying challenging behaviors are attention maintained that often is because it tells families and it tells children that we're really putting the onus on the child, that we're saying like the child just wants attention as if that's bad. And really that's not bad, right? We expect children to want that connection. And so it's up to us to look at what's happening in the environment and say, has the child really have we as adults really given the child enough attention that day or enough true connection with their caregiver to meet their needs? And that is how I think it's really important for us to help families kind of shift that thinking away from the challenging behavior is just attention maintained to have we really connected with the child enough? And that's not a bad thing, right? That children want to connect with us is something we want to support and something we know. Children are, especially toddlers, want to connect with adults. They certainly also want to show us their independence and to do lots of things independently, but they still want us to be there and to watch them do those things and to connect with us in really meaningful ways. So I have shifted a lot away from using the term attention maintained to really think more about, has the child had enough connections and connection with their primary caregiver, and really thinking about what are the possible unmet needs. And so unmet needs that might increase the likelihood that the child engages in challenging behavior are things like that social connection. Have they had enough time with their primary caregiver? Are they feeling okay? Are there differences across settings? Has there been some traumatic experiences that we need to attend to? That means the child has different needs for this day. Is there a lack of skill? Is there some sort of surge in developmental growth that we need to attend to? Are there some medical or health issues going on? Or perhaps is the social emotional environment not meeting the child's needs? And there are many other things that might be happening in the environment that could impact this, that might be possible unmet needs. Are there any other things that you have seen or that this is making you think of? I'm just going to pause here for a second and check in and see if there's any questions or any other thoughts around this that you want to share. Pull up the chat. No?
I would mention that as you're talking about this, I've been struggling with my wonderful teenage daughters, and I think this can be applied to all
Absolutely.
ages.
Yep. Absolutely. I could not agree more. And it's funny, it's like children want the same amount of connection, but as they get older, especially teenagers, I have an 11-year-old right now. He still wants that connection, but it's up to me to figure out what it looks like, right? He doesn't want he certainly doesn't want to like play a game with me anymore. And some older children do, but he really wants me to kind of just sit down next to him and be near him. So it's up to us as adults to figure out how to connect with children as they get older, as they age. But yeah, absolutely. And it's true for adults too. Anything else? So these are just some examples. A 6-month-old cries for long periods of time unless he's held by his caregiver. The tip of the iceberg behavior is the crying, right? The social emotional skill needing support is that the child wants to be held. The child wants to be held by his primary caregiver. What else might be going on for the child? It could be that maybe the child doesn't feel well. And we all know that babies want extra to be held more often, right? When they're not feeling well, when they have, some health issue going on. Or it could be a growth spurt, it could be sleep issues, it could be feeding issues. With a baby especially, there are many other things that could be happening that this wanting to be held for longer periods of time might indicate and are really important for us to think about. And that's especially, I like thinking about this in terms of kind of unmet needs and what's going on in the environment rather than just attention maintained, because especially for a baby, there's nothing like the baby gets our attention when they want it, and that's the same for children as they get older. A 2-year-old is always taking her friend's toy. What is the tip of the iceberg? Is taking her friend's toy. That's what we see. The social emotional skill needing support would be asking her friends to share, which is a lot for your 2-year-old. So maybe asking friends, taking turns, teaching the 2-year-old how to wait or how to find another toy to play with. And the unmet need could be that the 2-year-old wants more time with her, playing with her friends, wants to learn how to interact with her friends. It could be that with a 2-year-old, it could be that the 2-year-old's having a rough day and not feeling well. Maybe that the 2-year-old wants more time with a caregiver, but it could, in this situation particularly, it might be that the 2-year-old really just likes her friends and is still, as a 2-year-old, obviously very much still learning how to interact with friends. And so it could be wanting more time with friends, or different toys to play with. And then I know in EI, we don't, work with 4-year-olds, but I wanted to keep this example here just because it helps kind of illustrate what's going on. But with a 4-year-old who's refusing to help clean up, the tip of the iceberg is obviously a lot of times we would call this non-compliance, right? The child's not cleaning up when we want them to, or when it's time to. The social emotional skill is that the child is understanding cues in the environment and understanding how to clean up. What else might be going on? That the child might want extra time with whatever task they were doing. The child might have had a rough day. Something happened in the morning and he just doesn't like the transitions. The transition might be really hard, especially like a cleanup transition in a preschool classroom can be really loud and there's lots of things happening. So wanting to avoid that, it could be something happened over the weekend or in the morning, or it could be that the 4-year-old was engaged with a caregiver before it was time to clean up and wanted more time connecting with a caregiver, or maybe even connecting with friends. So those are all examples of kind of how to think about challenging behavior as being more than just the behavior happened and then like what is what skill does the child need, or what is the behavior communicating, and really thinking about the behavior as occurring within a context. And it's also important to remember that challenging behaviors are absolutely developmentally appropriate. And some behaviors that are challenging for adults are difficult for us to, difficult for us to kind of deal with are typical for young children, are behaviors that we expect young children to engage in. And that's just really important for us as adults to remember. And some examples of this, I mean, there are many challenging behaviors, right? With prolonged crying can really be hard for adults. Biting, physical aggression, taking toys, saying no, non-compliance. Those are all challenging behaviors that are very typical for 2-year-olds, 1 and 2-year-olds, and can be really hard for adults to see and really hard for adults to interact with and to deal with. Challenging behaviors are no longer developmentally appropriate when they persist over time or get worse or aren't responsive to the strategies that we're using. And so it's up to us to coach families in understanding all of this, and it's up to us to support families in recognizing what's happening in the context. And so we often talk about the ABCs of behavior. And that's the antecedent, what the behavior is. That's kind of the tip of the iceberg, what it looks like. And then the consequence or what happens after. And I would say too, to add to what, and to add this to what we just went over with the context, is that all of this occurs within the environment. And right, so none of this is happening in a bubble. All of this is happening in that context. Challenge behaviors occur when children need support around learning, communication, and social skills, but they often also happen in that context, right? To tell us about, and they are communicating that unmet need. So this is a chart that I love to share to think about the ABCs of behavior and how we can help families think about what the challenge behavior is trying to communicate and what the child's unmet needs are. And it always involves observing. So we look at the antecedent or the A, which is what happens before the behavior. The behavior itself is exactly what the behavior looks and sounds like. And then what happens after? And what's our goal for the child? What do you want the child to do? What does the family want the child to do in this context? And that's what we think about when we think about teaching the child new skills. So these are just examples of possible antecedents. The child's asked to do something, the child has difficulty. This is when we think about what the challenging behavior is. This goes back to the iceberg. Challenging behaviors, it's best for thinking about what skills we need to teach when we talk about the challenge behavior in terms of what's observable and measurable. So it's really helpful to think about what does the behavior look like and how can we measure it? And then the consequence is what happens after the behavior occurs. The child gets more attention from an adult or a friend, the child gets help, the child avoids an activity that they didn't want to do. And recognizing that all of this, just like thinking about the unmet need, the function is that meaning. So all behavior has a meaning and is communicating something, and that leads us right to what the function is. The function is why the behavior is occurring or what the child is trying to communicate. And remember, all of this can also be around those unmet needs for the child. If the behavior doesn't tell us exactly what to do, and usually it doesn't, thinking about those unmet needs, understanding the meaning does tell us what to do about this challenging behavior. So if we think the behavior is communicating, I want something or I need something, or I want to avoid something, it's really important for us to put that in the context in which it's occurring and to help families understand what that challenge behavior is communicating, and then and help the family think about what they want the child to do instead, either to communicate that or to engage in the environment, and then teaching that child the new skill. I'm going to pause here for a second because I know I've been talking a lot, and just see if there's any comments or questions or anything about all that was confusing.
I had a question.
Yeah.
So I love this where it's, we have to look at the child's behavior and what are they actually looking for. But I know oftentimes, like with parents, they're tired, they're worked up, they've got other kids. And
Mhm.
I feel like it's really frustrating and hard to kind of stop and think about these things in the moment. Do you have any tips for that?
Yeah, so absolutely. When the challenge, I think in those moments, the parent is frustrated, the child's frustrated. In those moments, it might be best for us to tell parents and families to just figure out a way to kind of dissolve the situation and like help everybody calm down without solving it. So just kind of like moving on, keeping everybody safe, moving on to keeping everybody calm, and then later thinking about why that might have happened. Because when everybody's already worked up, especially if you as a caregiver are already frustrated, it's likely you're not going to be able to solve the issue right then because you're already frustrated, you're already worked up, you're exhausted. And so it's often better to just say to families, you know what, I get it, it's really hard. What could just help us all calm down right now? And then we're just going to make it easy. And maybe that's putting on a show. Maybe it's, putting the child in the bath, giving the child a bath. Maybe it's a snack, something to just kind of help everybody calm down. And then later think about what might have happened. Later think about why that challenging behavior occurred. Were there unmet needs? And then start to address it then. Because we often say you're really not going to be able to teach new skills when everybody's worked up anyway. Does that make sense, Hannah?
Yes, thank you.
Yeah. And so these are other questions to ask. And these are things you might walk through with families. And you, Hannah, everybody has the slides, so they don't need to worry about like writing all this down. And then this is on the NCPMI on our website. We have so many resources for addressing challenging behaviors. This is one that I kind of love. And this, Hannah, goes back to that point. This is something that families can kind of think about and do after the challenging behavior occurs. You do not need to do this right during, but I love these for helping families kind of reflect on what did happen right before, what did the challenging behavior look like, and then what happened right after, and kind of what might have been going on. And it's just a really easy chart that can be useful for families. And then developing a plan with families for addressing these challenge behaviors. And I will say that, so once you get to the point, if a family has a toddler with persistent challenging behavior, then you will want to have a written plan. But even if you have a family who just has a toddler with some kind of developmentally appropriate challenging behavior, you still can come up with kind of an informal plan that will have these three parts. But if you're developing like a formal behavior support plan, you're at that tertiary level, then you will want to have a written plan. But sometimes with families, they have a toddler who has some challenging behavior that's really, starting to look like it might get worse if we don't do something. So you can come up with an informal plan to help the family. And I love also helping families think about whatever the antecedent is, what happens right before the challenging behavior, that tells you what preventative strategies you might use. And we're going to walk through these strategies in a second. And then what the behavior is kind of tells you what replacement skills, what skills we need to teach the child, or skills do we need to help the child use more often. And then consequences, we want to think about how to respond to the challenging behavior so that it becomes unlikely and less likely to occur. Prevention strategies are things that we do in the environment kind of before the challenging behavior occurs to make it less likely to occur. And we have 6 of them. I'm going to go over these 6 quickly just for sake of time because I want to give you lots of time for questions. But I love talking about these big 6 because they're important for all families all the time. These are prevention strategies, but again, we're talking about prevention at every level. So these aren't just when challenging behaviors occur. These are strategies that all families can do all the time. The first one is self-care. Helping families remember that it's really important to take care of themselves so that they can take care of their child and support their child. This is something I talked about, I think in the second session when we talked about nurturing and responsive relationships, helping families remember to certainly give the child, acknowledge when the child's behaving appropriately, but also remind parents and families and caregivers to just make sure the child knows that you love them throughout the day, regardless of what's happening. So that's like high fives, pats on the back, sitting down and playing with the child, which I know is not something that works for all families all the time, but engaging with the child maybe during meal times or, laughing with the child, smiling, reading books. So it's all those things that are positive attention that, what we call it, filling the child's bucket or filling the child's emotional bank. And we say that a ratio is at least 5-1, but we know some children need more. So, and that 5-1 is 5 really positive comments or positive behaviors. And it doesn't have to be verbal. It can be a thumbs up, a high five, a hug, a good hug. And 1 is a directive. So 1 isn't a negative comment, but 1 would just be a directive, like telling the child what to do. And that, if the parent does nothing else, that's what we want to see, more of. That's really how we create that connection. And really, it's the relationships are how we prevent challenge behaviors from occurring. I love this quote from Brown from Brenner: every child needs one person who's crazy about them. And then the third one is have a predictable daily schedule, right? We all know this, helping families think about, they don't have to have like the same time every day or even like routines, but really making sure that the child understands the schedule and understands what's going to happen when. And that predictability is going to go so far for preventing challenging behaviors. Children should really start to know what they're supposed to do. How do I know I'm making progress in that activity, not like in skill development? How do I know when I'm done and what do I do next? And then this can be really important for families, especially when they have difficult routines. And I know families don't necessarily use the word routine. So helping families think about what are their daily activities, and then making sure that those daily activities or routines look the same within the routine. So that toothbrushing looks the same. The big one, right, is bedtime. Let's make sure bedtime looks the same every night. That's going to go a long way for preventing those challenging behaviors. And this is just something you can think about with families. Schedules are kind of the big, like that everything is predictable and happens in the same order. And then routines are what's happening within those schedules. And that helping families kind of develop more predictability in their day can help everybody. And then helping families help their children understand what they expect them to do. Like, what do you expect the child to do during mealtime? What do you expect during bath time? Helping families understand what they expect, like what are your expectations, and then making sure their children understand those as well. And then this last one is also really important for us to start helping families do with their children, and that's teaching their children how to really regulate and express feelings. And we know that toddlers are not going to do that necessarily, right? But we can start to teach toddlers how to talk about their feelings, how to regulate their feelings. And we want to make sure that we're starting to teach even toddlers and infants, really, that you can have 2 feelings at the same time. You can be happy about one thing and sad about another thing at the same time. And that no feelings are bad, right? Mad, happy, all feelings are good and all feelings can exist. And then as children get older, we start to teach them more complex feelings. So those were prevention strategies and those top 6 are things we can really work on with families all the time. And then we want to teach children social emotional skills, right? To replace those challenging behaviors. So they learn those really complex communication skills and really complex social skills. And that we are reinforcing those skills. And those skills, we're helping families understand that when the child uses those new target skills, they have to be more efficient and effective than the challenging behavior was. It can be communication, social skills, calming strategies, following routines, waiting, tolerating delay. And then we will help coach families through teaching those replacement skills as well. And then responding to challenging behavior, we want to respond to challenging behavior in ways that make it less likely to happen again. And we really want to help families think about responding versus reacting, and that they're not just reacting to challenging behaviors, but they're responding in a way that makes the challenging behavior less likely to occur. And responding in a way that over time teaches the child there are different ways to get these needs met. It might be redirection, it might be a prevention strategy, it might be a reminder about behavioral expectations, it might be different alternatives, and these are all things we might do with toddlers and then as children get older. So the major messages here, and then I'm going to open it up for questions, is that behavior is learned. And at that, I want to just pause on that because it's really important for us to remember that these challenging behaviors are behaviors that children learn, they work for them, and so are the target skills. So we can teach those target skills and remember that we can teach children that those target skills, those other skills are more efficient, more effective than the challenging behavior. All behavior has meaning, all behaviors are communicating something, all behaviors occur in a context. We can use really individualized strategies and that everything occurs within the family. And we want to make sure that we're recognizing and identifying the family's values and beliefs when we're doing that. And I know that was a lot, and there is a lot in there. So we have time here for questions and comments. What are your questions, comments, thoughts?
I feel like, and this is probably behavior 101, but I feel like so many behaviors start when parents start overusing no.
Yes, that's a great
And
point.
and I try to teach positive parenting
Yeah,
and talk more about what the kiddos should be doing instead of
absolutely.
what they should not be doing.
Yep.
But I don't really have anything in my toolbox that really could be a go-to for parents to remind them.
Yeah,
Do you guys have anything?
Well, I think reminding parents, just restating the behavioral expectation, like that, the behavioral expectation, putting that out there, what the behavioral expectation is, can be really important. And then the other thing I would say to that, and then I want to open it up too to see what others think and other strategies people have used, is that it can be really important to help parents think about using, not in a like negative way, but using the fewest amount of words they can. Because once you get in that habit of saying no and don't do that, it's hard to kind of break yourself of that habit. So like thinking about if they can communicate something without words to kind of show the child what they want them to do can be really helpful. Because what I've found with myself, with families, with parents, and even with teachers, once we start using like saying no or saying something, like a redirection, like, don't hit your sister, it can be really hard to break yourself of that habit. Yep, I love this. Yep, let's be sure to stay in the area. So saying exactly what you want them to do. Yep, a lot of positive descriptive feedback is so important. And that positive descriptive feedback is critically important, and reminding parents that it doesn't always have to be positive descriptive feedback, right? We want to see lots of that because we want children to know that what they're doing is what we want them to do. But also it can be just a smile, like a big smile while you're looking at them can go a long way. Yeah, that's really good, Greta.
I tried to, one of my go-to for parents is to tell them, instead of always saying no, the child says, I want to go outside. And the answer is no. Try to say yes when. Yes, when your brother wakes up, or yes, when it stops raining, then we
Oh,
can.
that's great. Yeah, I love that, Tiffany. Yeah. Yeah, I love thinking about, instead of saying no, what they can do, right? And when they can do it. Yes, when. I love that. Yeah, I know, right? It is amazing how many times you say don't or no, or it, it's really, those verbal behaviors can be so just natural and you don't even realize how often you're using them. Yeah. And yes, then might be a perfect way to reframe that. And yeah, it's a first then too. So first, you do this and then we get to do that thing you really want to do. Yeah. Love these. Beautiful.
I think also is trying to help the child to explain or understand why, especially as they get older, they need to understand the why behind your no answer if it is a must.
Absolutely. Yeah, that can be really helpful. Yeah, that's a great point.
Erin, did you see the question in the chat?
Oh, yep. Sorry, I just saw it. Difficult behaviors don't stop our lesson. So yeah, oftentimes we say that, that last slide was about that challenging behaviors are learned. And so it can take sometimes we say don't make a change to what you're doing for at least 10 to 12 days, because it can take that long to see a change in what the child's doing. So we say at least 10 days, and it can take some time. And they're not going to stop our lesson right away. And sometimes they might get worse. So we often talk to the family about how are you going to take care of yourself when that behavior gets a little bit worse, or if it gets a little bit worse. And how are you going to take care of yourself while as you know that this child is learning this skill and it's going to take some time. Does that make sense? Yeah, that is so true. You want to give them the words to describe the behavior you want to see. Otherwise, I mean, we all know children like this where we say like, don't jump in the puddle. And they're like, okay, there's the puddle. I'm going to jump as fast as I can. Rather than let's walk around the puddle.
Along those lines, we also know that children don't understand negation at an early age. And so when we say don't jump in the puddle, all they hear is jump
Yeah.
and puddle.
Yep, that's what they're envisioning. Okay. What else? Was that helpful, Kate?
Yes, very much.
Perfect. Cool.
I have lots of families that will try something, for a day or two and get frustrated. So I like that 10 days.
Yeah. Yeah, and always giving choices that are real choices. Yeah. Choices are a great prevention strategy. Yeah, that is so true. Adults are the same. And this actually, all of this works the same for adults. It's just that the skills can be a little bit different.
Well, great. Thank you so much, Erin. This was wonderful. It was great
you.
having you for all of these sessions. Thank you so
you.
much.
Yeah, thank you. Have a great rest of your day.
Thanks. So we will now go ahead into our last half hour. We will have a quick presentation by Kate, and she'll just talk about one of the families that she's working with, and then we'll go into breakout rooms and discuss for a few minutes, and then come back for the last couple minutes. So let me pull up that presentation. Oh. And whenever you're ready, Kate.
Thanks, Hannah. All right, so my name is Kate Mortensen. I'm a speech pathologist. I work for up to 3 early intervention, and my assigned area is Box Elder County. I've worked here for 2.5 years. I worked as a SLP for Cache County School District in their preschool program for 6 years, and I went back to grad school as an adult with my own kids and family. Previously, I've done lots of different fun things. I was a children's librarian. I was a historical 1917 site interpreter, a tier 2 reading group instructor, a paraprofessional, and my husband and I managed a campground up in Montana, which was a lot of fun. But this has been my favorite job by far. I love my job. Next, I have a family to present to you guys. This is a family that I work with here in Brigham. They're a new family for us, and there's a lot of different things happening. So I have changed the names just so we're not having any concerns about privacy. So the family lives in Brigham. They speak English and Spanish equally. Mom requested evals and visits in English, and so they are newly referred to EI. Mom's name is Natalia. She's in her late teens, early 20s. She's working full-time in both Logan and Ogden, depending on the day. Dad's not currently able to live with the family. He and Mom are in a current relationship, but he's not been able to live with the family for almost 2 years. The older son, I decided to name him Igor, is 30 months old. He was referred by a pediatrician. He says about 10 to 15 words. He does not speak often and is really difficult to understand. He hits people and things when frustrated, including himself. If Mom tells him to stop, he will increase the length and intensity of the hitting. He's not yet pointing to indicate his wants. He generally does his own thing and can be emotionally reactive to many different situations. He is quiet and withdrawn much of the day. He does not really interact with the other kids at daycare and doesn't really play with toys. He can be really hard to socially engage. The younger son is Andre. He's 18 months. He is really fun and playful and really cute. He's outgoing with an easy smile. He's a busy kid who is always into everything. He says around 5 words and his speech is easier to understand than his brother's. Andre is very attached to his extended family, aunts, grandmother, grandfather, as the boys spend a lot of time at their home. He has recently started to hit his brother often. Daycare reports that he has been hitting other children and forcefully taking toys from them. He was referred by his mother. She is worried that she has caused him to be delayed. Mom's concerns and priorities. Her partner was forced to leave their family a few months before Andre was born. When Andre was born, Igor had just turned 1. They were a week after the older son turned 1, the second son was born. And She felt very alone and overwhelmed and went into a deep depression. She reports that she stopped talking. She tried to give the boys everything that they needed. She fed them and clothed them, but she really didn't talk to them or interact and play with them. Natalia has recently taken the boys to the pediatrician, and the doctor recommended early intervention services. The doctor is especially worried about the older son, Igor. The conversation Natalia had with the doctor has made her feel an enormous sense of guilt. She's a very sensitive, loving mother, and she now feels like it's all her fault that her children are developmentally delayed. So she's really motivated to work with her kids. She wants to help them catch up developmentally. Because she works full time, she feels like the hour from 4 to 5 is the best time to focus on strategies and interventions. This is generally playtime for the family. It's after they get home for the day and before she starts to make dinner. Mom is open about other evening routines like bath time and bedtime, but would rather begin with playtime. Here are their scores for their assessments. The older son, Igor, on the Battelle Developmental Inventory, gross motor, fine motor, social emotional, and adaptive all scored not significant. Cognitive, receptive, and expressive language were severe delays. ASQ, communication, 20 out of 33. You can see the scores there. Pretty much no concerns on most of those there with the ASQ. And the ASQSE, 60 out of 85, no concern. The AEPS is something that we give kiddos with communication issues, and he did score a severe delay in communication. Hearing and vision passed screenings. Andre passed his screenings in hearing and vision. On the BDI, everything was in the not significant range. The ASQ communication was 5 out of 16, and that was the only score we had for some reason. ASQSE, 35 out of 65, no concern. AEPS does show a mild language delay. And so early intervention was offered to the younger child without a standardized score backing it through an ICO because of behaviors observed and mild speech delay. All right, so these are the these are the outcomes that were written on the initial IFS piece. Mom would really like to provide a good example for her boys. She's very concerned that her depression and lack of engagement have harmed her kids, and she's fully committed to doing whatever is needed to help her boys. She would like for both of them to receive services with speech and language and behavior. She would like help learning how she can best utilize that 1 hour after work and before dinner to provide language and behavior supports. She would especially like learning how to help learning how to play with them. Hannah, do you want me to read those goals, or can we all read them?
If you could summarize just really briefly.
Okay, so Igor has 3 goals. One about identifying receptive language and expressive language, identifying body parts and pictures in books. He will participate in daycare by increasing his communication and interactions with his peers. And then he'll participate in playtime by expressing his emotions appropriately. Family, Natalia will be able to respond calmly and appropriately to Igor during his tantrums by increasing her patience and tools is the goal that was written there. And then Andre is going to also have some receptive language goals by pointing to body parts and pictures, and an expressive goal that we would like for him to use 10 new words during play.
So thank you so much, Kate. We will now go ahead and go into breakout groups. We have, sorry, I have a little bit. Who are our groups today, Faustine? Oh, with Aubrey and Janet, if you guys could cover tier 1 strategies and discuss about that. And then Amy and Ankita, if you could discuss tiers 2 strategies where it's more targeted supports. And then Sue and Mandy, if you could do, and Betsy, if you could do tier 3, where it's more the intensive intervention. And if any of you have questions about what those are, you can just reach out to your hub members in the group. And it would be great if you could all have your cameras on. And if you want to take a minute to introduce yourself, that would be great. But just focusing on what strategies we can give feedback to that will help the family achieve those goals. And Kate, if it's all right with you, I'll just take you for a couple minutes into each group if anyone has any clarifying questions. And we will come back around a little after 2:20. Thank you so much, Kate. That was great. Thank you for your presentation.
Well, I hope it was okay. I didn't do much.
No, it was perfect. And are you cool if I move you to all of the different breakout groups?
Yeah.
Okay, perfect. And then I'll just plan on leaving you in the last one after we're finished with questions. Everyone will be joining back in just a minute. I'll just wait for everyone to get back to the main room. Hi, everyone. Welcome back. I hope the breakout rooms were good and you had a nice discussion. Just a reminder, if you took notes, please send those to Faustine so we can get all of those notes to Kate. And I just wanted to take a couple minutes and talk about one or two things that your groups discussed. So we'll start with Aubrey and Janet's group.
Okay. So I first talked about validation, validating the things that mom's doing, pointing out things she's doing well, and making sure she has support. And they're an extended family you talked about are there for her and can give that support. Sam talked about trying to get families together, maybe have a community, a few families together to help build community. Mentioned that I think it's a family center in Logan where Vonda works, to look at that as a resource. Do they have any play and support groups there? Teach simple play skills, might be concrete, might be more open-ended, following the child's lead. Help mom set up routines in the play, maybe a simple visual schedule. Anybody ever forgotten anything? Anybody? Okay.
Awesome. Thank you, Janet. And then we'll go over to Sue and Mandy's group.
Let's see from my notes. So there was really great ideas about adding visuals to the environment. So visual schedules, visuals about social emotional kind of activities, and to help increase that positive interaction between mom and the children, and the other caregivers are as well, you know, filling that emotional piggy bank. So that was a big one, just like it was in Janet's group, but a real emphasis on our group about thinking about visuals in the environment for both mom to help guide her daily practice, and for the children to help them understand the routines and the schedules of the home.
I love that. Thank you. And then finally, Amy and Ankita's group.
Yeah, we had a lot of great ideas. The big ones was maybe giving mom like some activities like on popsicle sticks that are quick and easy and fast, and different ideas that she could do so that when she's kind of in that targeted time, it's pull one out fast. Okay, what does it say? If that one doesn't work, like let's try another one, but just to help to kind of give lots of ideas to her that she could kind of continue on with. We also talked about, maybe being videotaped for then that feedback. If that was something that she was interested in doing. Also mentioned some visuals, some schedules, kind of building like the routines for her to support her kids.
Awesome. Thank you, Amy. Thank you all so much for your participation and your feedback today. Just a reminder, again, send those notes to Faustine and please fill out the survey link. You can click the link in the chat, or we will be sending out that link in a post Echo email to you all. And last reminder, our next session will be on November 25th. It'll be a new registration link, which will be sent out in the next week or so. It'll be same time, Monday from 1 to 2:30, and we hope you will join us. Have a great week, everyone.
Hannah?